Hi everyone, thank you so much for joining us. We're delighted to be here with Donna, Smalley and Tracey Barningham. Hopefully I said that right. So Donna and Tracey are dedicated members of the Keeping My Chest Healthy service, bringing compassion, experience and a patient-focused approach to supporting individuals with chest health and respiratory well-being. Both are passionate about helping people improve their quality of life through education, encouragement, and personalised care. So I'll hand over to the two of them.
Hello, yeah, thanks for inviting us. My name's Donna. I'm physio lead in the learning disability team at Bradford District Care Trust.
Oh, and hi everybody, lovely to be here. I'm Tracey, I'm a community learning disability matron and I work with Donna here in Bradford. So today we're going to talk about respiratory health for people with a learning disability, and many of the principles that we'll cover today are also relevant to other groups such as people with neurological or progressive conditions. So we're going to look at how the way we move, position and support people every day can play a vital role in improving chest health and share some of the practical resources from the Keeping My Chest Healthy project that you can use in your own practice. So why are we interested in chest health? Well, people with a learning disability are at increased risk of respiratory illness, and we're going to look at this in more detail later. But for some people, that can mean repeated chest infections or frequent and often lengthy hospital admissions. But when we talk about respiratory health, we need to be thinking about much more than chest infections or symptoms alone. Rachel Knight-Lozano's Chesty study offers a really helpful way of thinking about respiratory health in the context of disability. And if you haven't come across the research programme before, I'd really recommend you looking at this, and I'll drop the link in the chat in a second. But she describes respiratory health as breathing with comfort and effectiveness to participate in daily activities, prevent avoidable illness, recover when unwell, and thrive in everyday life. Because respiratory health isn't simply about the absence of illness, it's about the person's lived experience of breathing. What is normal for that person? Are they comfortable? And is their breathing effective enough to give them the energy and the capacity to do the things that they want and need to do each day? Because when somebody's respiratory health deteriorates, the impact often reaches far beyond a chest infection alone. It can affect confidence, communication, independence, and day-to-day life. So it's not just about preventing hospital admissions, it's about supporting people to thrive and really live the life that they want to live. But we also know that for too many people, this is not just about quality of life, it's also about avoidable illness and avoidable deaths. So if we look at the leader data that's here on the slide, we can see that the inequalities faced by people with learning disabilities remain stark. People with learning disabilities are still dying far younger than the general population, so nearly 20 years younger, and over 40% of those deaths are considered avoidable. Respiratory disease continues to be one of the leading causes of death, and this is something that we see consistently in the leader data year after year. And for people from minority ethnic communities, the inequalities are even greater, with deaths happening significantly earlier than in the wider population. So these inequalities are real, they're persistent, and they're exactly why prevention and early recognition matter so much.
So when we're thinking about respiratory risk, people with learning disabilities are not experiencing completely different risks to anyone else. We know that respiratory illness can affect anyone. What changes is often how often those risks appear together and how they interact. So for people with learning disabilities, there's often multiple factors that present at the same time that increase vulnerability. And they're well described in the British Thoracic Society clinical statement for community acquired pneumonia. And that gives a really comprehensive overview of respiratory risks for people with a learning disability. But if we look at this slide, it shows a really broad range of risks that were identified by a group of professionals in a previous session. And you can see that none of these risks are specific to people with a learning disability. They're the same risks that we see in lots of other groups too. So, for example, people living with MS or stroke or an acquired brain injury, dementia, and other neurological or progressive conditions as well. But what's different is for these groups of people is it's not the risks themselves, but how multiple risks often cluster and interact. I think you can probably see also that it's not about rare or specialist problems. So most of these risks are things that you can identify through everyday observation and conversation. So things like you can see posture and positioning issues, reduced mobility, poor oral hygiene. You don't need any specialist equipment or specialist respiratory experience to notice these. There's also things on there like cough strength. Does the person have an effective cough? Do they need support with movement and function? Are there concerns around their muscle tone? Are there any eating and drinking difficulties? And what you'll quickly see is that these risk factors don't exist in isolation. Many of the risks sit outside what we might immediately think of respiratory risks, but they often combine together to create almost a perfect storm, really. So if we ever think about this in relation to a case study, I'll introduce Mark and just tell you a little bit about him. So as I talk through the case study, which is also on the screen if you prefer to read it, just listen out for anything that could be a risk or a potential risk for his respiratory health. So some of the information is relevant, but some of it's a bit of a red herring as well. So as you listen, just keep a count and see how many risks you can identify as I'm talking through. So Mark, he is a 48-year-old man and he loves rock music. He likes going to concerts with his girlfriend Joanne, and he's a big football fan and he rarely misses the chance to see his local team play. Mark has a learning disability and he lives in supported accommodation, sharing his home with 3 other people. Over the last few months, Mark and those close to him have noticed some changes. He's had 2 chest infections in the last year, one of which required a hospital admission. Since that admission, his mobility is reduced. Previously, with time and support, he could complete standing transfers, but during his stay in hospital, he was hoisted, and he now uses a sling for transfers at home as well. Mark has always enjoyed sedentary activities and does very little physical activity. He loves curry and spicy foods, but recently he's been coughing more during and after meals. He eats independently, but he tends to eat quite quickly and take large mouthfuls. Sometimes after eating, he can appear uncomfortable and say that his chest burns. Sometimes Mark refuses meals altogether. Mark's got reduced muscle tone and his posture's become more slumped in his chair. During meals, he often slides down in his seat. Staff have also reported periods of constipation and that Mark's recent hearing test showed moderate hearing loss. Mark's often tired, but he says he doesn't sleep very well, even though his housemates say they hear him snoring loudly every night. Mark enjoys singing and has a clear, strong voice. Mark's girlfriend loves singing with Mark, but says that he's got bad breath. So if you want to put your answers in the poll, there's a multi-choice. How many risks did you count, or potential risks? I don't know if I can see the poll results here, but
I can share them once they
yeah,
start to come
thank
through.
you. A few people put 9, 8, 12.
So 7 is the most popular at the moment. 40% of people say 7, 30% say 12, 10% say 15, and then it's kind of 10 and 10 between 5 and 9. So.
Thank you. So there's quite a varied response, but most people have picked quite high. They've identified quite a number of risks. So I guess for Mark, there are quite a few possibilities, and we'll go through what those risks are. Do I just need to share my slides again?
Yeah, just reshare them, Donna.
Yeah, that's fine. So the answer is actually 12. So well done if you got 12, and we'll just go through some of those now. So first of all, he's had 2 chest infections in the last year, one which required a hospital admission. And we know that the history of respiratory illness is one of the clearest indicators of future risk, especially if we're not sorting out what the underlying cause is, and they haven't been addressed. So the hospital admission on its own is important, because we know from the BTS clinical statement that once somebody has been admitted with a chest infection or a pneumonia, they're more likely to have further admissions. So it should always prompt us to think about prevention, and what we can do to prevent further admissions. There's also been a really clear change in his mobility levels. So since his admission, he's moving less and he's no longer completing standing transfers. He's got reduced mobility, which is meaning fewer opportunities to take those deep breaths and move the secretions effectively from his lungs. Alongside that, he's got a fairly sedentary lifestyle, which means fewer natural opportunities for movement, which get him out of breath and get his lungs expanding. And there are also eating and drinking concerns. So he's coughing during and after meals. He's tending to eat quite quickly and take large mouthfuls, which raises concerns about swallowing safety, possibly aspiration, and particularly when combined with poor posture when he's eating and drinking, or low tone. So we can already start to see a pattern emerging around that previous respiratory illness, the reduced movement, eating and drinking concerns. And when we build on that, there's several other details that kind of add to this picture. So the chest burning and the occasional refusal of meals could suggest reflux. That's often missed, we find, but it is significant for respiratory health. Alongside that, the reduced muscle tone and poor posture will have a huge impact on his comfort and his functional abilities. His compromised position will also impact on his ability to breathe, to cough, and clear secretions, and his ability to eat and drink safely as well. Constipation and poor oral health, dental illness, they're major, but another area that's often really overlooked in terms of respiratory risk. And then you might have picked up on this one, the poor sleeping and the loud snoring. That raises the possibility of obstructive sleep apnea. So especially when you combine that with low muscle tone, possibly a high BMI, we'd maybe be wanting to think about that for Mark, and maybe looking at doing something like the stop bang. So everybody got quite a few risks, so that's good. But I wonder if any of those came as a bit of a surprise, or if they were all quite obvious. It's a bit difficult in a case study, but I think sometimes when you're talking to a family, we're giving you a lot of information, maybe don't know what information is relevant to share. It's often more difficult to pick those things out. But I think the key point is it's not one thing that's explaining Mark's risk. It's a combination of these risks, how they interact, and that builds a bigger picture. And families and carers who are supporting people on a daily basis are really best placed to recognise these risk factors, and they play a really vital role in highlighting concerns and supporting us with strategies to minimise the risks. But individually, as I've said, they might not seem significant, but when we join the dots, we can hopefully identify the risk earlier and intervene sooner. And what we've done in Bradford is develop a respiratory scoring tool, which incorporates all of the risks that are identified with the BTS clinical statement, and it helps clinicians to bring everything together in a really structured way so that nothing gets missed. So it also gives us an overall score, which helps us to quantify that risk and support some earlier intervention and more proactive care planning. And through the work that we're doing and the outcomes that we can share a little bit later, is that the cycle of declining respiratory health, repeated chest infections, repeated hospital admissions, it's not inevitable. If we can recognise these risks earlier and put preventative strategies in place, we've got some real opportunities to improve outcomes and quality of life.
So I think one of the challenges that we have is that many of the people we support can't always tell us when they're becoming unwell. And if we want to recognise when somebody's becoming unwell, we first need to understand what well looks like for that person, because this can be very different from one person to another. Often the earliest signs of deterioration can be really subtle. Somebody might be quieter than usual, they may sound different when they speak, or just might, not quite be themselves. And it's those really small changes that are often noticed by families and carers who know the person really well. As part of the Keeping My Chest Healthy project, we really encourage people to build up a picture of what the person looks like when they're well. So how they look, what their voice sounds like, and how they enjoy spending their time. And we also record the person's well baseline observations. So we look at temperature, respiratory rate, oxygen saturations. And this can be really important because for some people, their usual readings just might not sit within the expected normal range. We supported one young woman who was having repeated hospital admissions for pneumonia. She was really active, independent, and she absolutely hated being in hospital. And we tried absolutely everything to prevent these. But it was only when we took her baseline readings that things started to really change for her. Her usual temperature was actually much lower than we expected. So a temperature that appeared normal on paper was actually a really early sign that she was becoming unwell. And once we recognised this, the infections could be picked up at much earlier and treatment started. And she was really able to remain well and at home and avoided further hospital admissions. So tools such as care plans, health passports, Restore 2 Mini, these can all be used to help people record and share what's normal for the person, what changes to look out for, and what support helps keep them well. Here in Bradford, we've developed the Keeping My Chest Healthy care plan, which is what you can see here on the slide. And really, this is an accessible document that brings together all the advice and recommendations that are really unique to that person into one place, so that carers and professionals who might not know that person well have got all the information and the confidence really that they need to be able to support their respiratory health. Because ultimately, this is about knowing the person well, and it's about recognising and noticing changes early and feeling confident to act before somebody becomes seriously unwell.
Okay, so once we understand what the risks are, that's when the real opportunities come. So we can really start to support people to reduce and manage those risks in a practical way. So here in Bradford, we co-produced the Keeping My Chest Healthy digital hub alongside a focus group of experts by experience and families, carers, professionals. And the aim was for us to create something that was genuinely useful and accessible and practical for people to manage and reduce these respiratory risks. So Tracey's just sharing the website here, and what you can see is our home screen. All of the text on the website is fully translatable. And if we go from left to right on the screen, the website includes, so the green tab is a health promotion area. So that includes like different resources to support with health promotion. And then next, there's the purple tab, which is education resources about specific risks. So you can see, there's a number of different risks there and how they can be reduced. The next tab along is the blue one, which is where you'll find a suite of videos which demonstrate techniques and interventions in practice. All of the videos are currently in English and Urdu because those were the priority languages for our area. But they've not just got subtitles, they've got fully spoken narration, so it makes them accessible regardless of literacy or language. And there's also a section on the website about recognising when somebody's becoming unwell. And our focus group were involved at every step of the website creation. They set all the priorities for the website, they designed the look and the feel, they chose the music and the images and the animations, they helped with the scripts and starred in the videos and all the images that you see across the website. And we will share the QR code, although it's a bit behind us, you might not see it. We'll share it at the end and a link to the website so you can explore the resources for yourself. They're free to access, so do feel free to access them, share them with anyone who you think would benefit from them. So if we go back to Mark, if you can remember the case study at the beginning, and have a think about what resources might be relevant for Mark and to share with him. So we know, as we've discussed, there wasn't one factor that explained the risk. It's a combination of reduced mobility, posture, issues around meal times, possible reflux, constipation, poor sleep, oral health, and he'd had previous chest infections as well. There was a number of different things. So one useful early intervention might be to think about the annual health check, because that will give an opportunity to review his overall health, his medications, vaccinations, and issues like constipation, reflux. So rather than looking at each issue in isolation. So in the health promotion section, which Tracey's just sharing, there's some resources that might be useful to direct Mark to and to support with this. So throughout the website, there's links to trusted resources, and we use animations and images throughout the website just to try and help explain more complex concepts. And then I suppose in the risk factors section, there's a whole suite of things here that might be useful for Mark. So there's information about sleep apnea, constipation, heartburn and acid reflux, mouth care. Tracey just clicked on the posture one. So yeah, there's a little animation there. There's also some resources about why limited movement is a risk factor for healthy lungs. So all of these resources could be useful for helping Mark and those who support him to understand why they are risks and how they can impact on his respiratory health. And we also thought we might be thinking at this point about an eating and drinking assessment because of the issue around coughing around meal times. Probably also want to think about a seating or a posture review, given the changes since his hospital admission, which are also going to impact on his breathing and his eating and drinking. So on the website, in the resources sections, there's some videos that would help to support this. So there's a video on safe and enjoyable meal times. There's a video about posture for eating and drinking, and these might be useful for Mark. So this, yeah, you click on the video and then you can, at the minute, you can look at it in English or in Urdu. All the videos are short. The focus groups told us they wanted short, bite-sized videos, so they're all under 3 minutes. And the focus group said they just wanted the information that was relevant in a really short, bite-sized way. They didn't want any of the fluff around it. They just wanted us to get to the point. So that's what we've tried to do in these videos. So I think you've selected breathing games and activities as well. So, we also want to think about movement and mobility and chest clearance, but this is where it's important to maybe think about that earlier definition of respiratory health. It's about helping Mark to breathe with comfort and effectiveness so he can take part in daily life and thrive in a way that matters to him. So for Mark, it's not just about what interventions we need to put in place. It's about how do we build support to manage that into everyday life in a way that works for him. So I guess for Mark, we know he loves music, he enjoys singing, he likes going to concerts, and he's a big football fan. So if we're thinking about breathing games, movement, stretching, position changes, or activities that could help with chest clearance, they don't need to feel like a separate medical task. They can be built into everyday routines and an enjoyable part of the day. So that might be through singing, reaching, stretching, dancing, anything that kind of supports that, that increased expansion of the lungs. And just to facilitate that chest clearance. And on the breathing games and activities part of the site, there's kind of ideas there for everyone, regardless of mobility levels. So it does include ideas for people who've got little or no voluntary movement as well. There's also other videos on there which demonstrate how to support someone with chest clearance through chest physio, perhaps, or how to use a cough assist or vibro vest, as well as videos on how to use other piece of equipment like nebulizers, suction machines, those types of things. But have a look, they're all there for you to kind of explore later.
Hopefully, I think what we've shown today is that kind of supporting chest health is not about finding one magic answer. Really, it's about understanding the whole picture, knowing the person well, and building that support into everyday life in ways that are really practical, meaningful, and sustainable. For Mark, that means support that helps him stay comfortable, active, involved, and able to keep doing the things that he enjoys. And really, the message that we hope people take away today is that respiratory health is everybody's business. And it's small, practical, person-centred actions that can really make a big difference. Donna's going to share the outcomes on the website, which you'll be able to have a look at later. But in Bradford, what we found is that when we shifted our focus from reacting once somebody became unwell to looking at prevention and promoting respiratory health, we started to see some really positive outcomes. Our service evaluation that you can see here showed reductions of 40% or more across all respiratory related healthcare contacts. So this was fewer GP appointments, fewer antibiotic prescriptions, fewer A&E attendances, and importantly, we saw a 76% reduction in hospital admissions. And these results are really encouraging for us, but really more importantly, they represent a really significant improvement in day-to-day life for the people who were involved. So we'd really encourage you to have a good look at the website after the session. You can find more about the project, the evidence base, and the outcomes, and you can explore the resources. And as Donna was saying, just share them with anybody, you know, they're free for anybody to access. And I think they work really well on your mobile devices. They're really, they're really accessible from mobile phones. We hope to give you some good ideas that you can use straight away in your practice. But we'd just like to finish by sharing Jessie's story. Jessie's a member of the Keeping My Chest Healthy focus group, and she's been involved in the project all the way through, really, in a number of different ways. And here her granddad helps to tell her story.
Jessie lives with us in an adapted house for her, with me, my wife and Jessie's mum. Jessie has had complex needs since she was born. She has epilepsy, partially blind, but she can't walk. She could eat at the beginning, but now she's built nil by her mouth.
Oh, we're buffering.
Thought things were going a little bit too well.
I've known Jessie since 2018. Jessie's personality is very cheeky, very loud. She's always full of fun. Jessie was quite ill a couple of years ago.
In Jessie's case, family knew something wasn't right. She'd had some hospital admissions, so they ran to check to us. It highlighted the need to rescore her. We found she was very reliant on her secretion-reducing medication, and this was key to keeping her chest healthy and reducing her aspiration risk. So next, we repeated her baseline readings and noticed that the baselines of her oxygen saturation levels had changed. This is key to knowing when she's well and when she's becoming unwell, so that needed to be documented in the care plan so that it was an up-to-date baseline for her. Another action that we took was to review Jessie's specialist seating. Seating is key to keeping her in a good position so that she's well positioned for her peg feed, and that is key to maintaining really good chest health for her.
Before the care plan was in place, Jessie would land up at BRI 4 or 5 times a year with a chest infection. This year, which is now November, she hasn't seen BRI once.
Jessie's now got a suction machine, a cough assist, a nebulizer. She's peg fed as well, and all the information regarding these bits of equipment can be found in the respiratory healthcare plan. It includes the tiny little details that not everybody would notice straight away regarding Jessie. It could be that she's sleepier than normal, a little bit more teary, quieter, but these are indications that she could be unwell and it needs to be dealt with fast.
We've now managed to gather all the information that we need about her posture, her medication and her new baselines, pull that together into a new care plan so that that can be disseminated to all the staff and people that spend time with Jessie, and we can keep her as well as possible.
go back to the slide so that you can see the QR code and the link. And just to say thank you for inviting us to join you today, Norma and the group. And do feel free to get in touch if you want to know more about the project or about using Keeping My Chest Healthy in your area. But again, as Tracey said before, do feel free to share the resources with anyone who you might feel would benefit from them. And yeah, we're happy to take any questions if there's time.
Yeah, if anyone has any questions, if you put them in the Q&A box, we'll try to get them answered. And lots of great feedback, ladies. If you see it in there in the chat box, everyone's saying how amazing it is. Great website, so much hard work put in there. So everyone's quiet today. It's lunchtime, I suppose.
Yes.
No. Well, no, that looks like you've obviously answered all the questions. So, is there anything else you want to add before we finish?
No, just there's the page on the website. If you're wanting to get in touch, there's a contact form that you can use to get in touch if you want to ask anything, if you think about anything later when you've had a chance to have a look through the resources. And we're always hoping to build on these resources as well. We're looking to to add to these. These were the priorities set by our focus group as kind of a first phase, and we know there's other things that we want to add to the site. So there's quite a few ideas in development for the future. So yeah, watch this space, keep an eye on the website because it's changing all the time.
Yeah, so we have a couple of questions. So we have Gillian from Fife. We were interested in LD Physio Fife, but tend to use PEP mask and AD belt. Are there any plans to widen the information on treatment options? And so that's just in the Q&A box if you want to reread it.
See if I can find it. Yeah.
You just drop down into the comments.
Oh yes, I can see them. Yeah.
That first one.
Yes, I think I probably just answered that. Yeah, we hope to add resources. As when we first started this project, we didn't really have any funding or any dedicated time, so we've kind of built incrementally to the site. And as I was saying before, we wanted everything on there. We wanted all the languages, we wanted all the resources, and it just wasn't realistic. So we've had to start off with the priorities sort of as defined by our focus group and the people that we use in the resources. But we do have plans to keep adding to those resources, build on the languages. So there's quite a few things in the pipeline. And I think it was important to say we're respiratory specialists in our team. We're a learning disability team. And so we're not doing anything that sits outside of that. So some of the resources that are on there that you'll see, like CPAP and things like that, they were guided and directed by the specialist services that do issue those machines and prescribe more specialist respiratory interventions. So yeah.
And then there's a few more there. I'm not sure if you're in a position to answer them, but how do you manage posture in bed?
So there is a section on posture and the importance of positioning. 24-hour posture. So there is something about managing posture at night time as well, and the importance of that. There's some nice animations that we had done, which kind of show what's happening to you in terms of your eating and drinking and your bowels and reflux. if your posture is compromised, and it really kind of drives home the importance of really supportive posture, both in seated and in lying. So have a look at some of those resources. But again, it's not it's an area that we do intend to build on. This is giving you the overview information at the moment around why some of these things are important in terms of risk and what you can do about them as well.
And I think what we try and do as well on the site, sorry, I was just saying we try and link people to other resources that are there as well. So kind of throughout the website, we're always adding in links to kind of trusted resources that people can access that have maybe got a little bit more detail on there.
I was just going to say I've just put in a link to the posture section there, and the search bar was really easy to use. So if anyone has something in particular, just pop it in the search bar of the website. And both Donna and Tracey are going to be speaking at our 24-hour postural care conference on the 16th of June in Newcastle United. So that'll be another great opportunity to follow up on that. We'll just go for one more question. Is this now included in the passport for LD patients? That's from East Cheshire.
I'm not sure. So I guess everywhere has slightly different sort of health passports. I'm assuming that you mean like the health passports. And I know there's lots of different variations across the country, really. So, people have got different approaches. I think one of the things that we're doing at the moment is we're kind of expanding the work. So, we do have a section of the website that's focused on sort of the clinical pathway that we follow and some training resources for health professionals. But we're also trying to sort of get embedding this process and the scoring tool into annual health checks and really get the approach running through primary and secondary healthcare so that people so we're picking up early, basically. When people are having that annual health check, it's a really good opportunity to sort of identify these risk factors rather than waiting until people are already starting to become unwell. But equally, looking at when somebody's had a hospital admission, like Donna was saying when we were talking about Mark's case study, if we can pick up when somebody has had a respiratory related hospital admission, that gives us a really good chance to kind of really explore things and unpick what those risk factors might be in a really proactive way. So whilst it may be included in some health passports, I guess for us we're trying to embed it in the actual annual health check so that the kind of approach is kind of sort of considered across the board, really.
Just a couple of people have asked the clinician login on the website. How do they get that? I know it says on the website your organisation should have already adopted the KMCH pathway to get login. Is that right?
Yeah, so all of the sort of patient-facing resources and family resources are free to access and always will be. And I guess for our area, we were looking at building some sustainability around the project. So we've put out all of the training modules around how to use the pathway and the resources and the tools that we use, like the scoring tool and the assessments that we use, the care plan templates. They're all on the website, but in the clinicians login area. So trusts can sign up to have access to the logged in area. And if you want any information around that and kind of what that includes and how you can access that, if you go to the Keeping My Chest Healthy in Your Area, if you go along the top bar, it says KMCH in your area, and that is kind of a one-stop shop for all the information that you might need. So other trusts have approached us. Again, as I said, we've done this as kind of part of our day job. And there's no funding to kind of keep things going. So we're looking for a way to keep the project sustainable in terms of, hosting the website, but also so that it can be a growing community of practice, so that we can add to the resources and the languages so that, anything that's added will be to the benefit of everybody who's got access to those resources through the password. in the past, we've kind of helped areas to develop their business cases using our evidence and our outcomes, and the economic analysis that we've had independently commissioned to kind of support trusts to be able to adopt this. So if we can help in any way, do get in touch, and we'll share what we've got, because it's we're great believers in don't reinvent the wheel. We're all busy working hard, and we don't all need to be busy working hard on the same thing. If we've already done it and it's something we can share, we're really happy to. So yeah, get in touch.
Great, thank you so much. So thank you everyone for attending and for all your questions. The recording will be available in the post-event email, so keep an eye out for that popping into your inbox. And thank you for joining us today. Thank you, ladies.
Thank you.